So, hello everyone. So, I want to educate you on a common type of disease condition mostly faced in Nigeria around the world, which is normal malaria. When people come to the pharmacy, I have malaria, I have malaria, and I have malaria. So, what do you actually understand by malaria? And how long do you think it takes for the plasmodium species to come back into your system after treating malaria? I'll take you on this journey. So there are important information you need to know about malaria as well. Most people ask what's malaria, what actually causes malaria. So malaria, first thing you need to know, is a disease condition that is caused by a particular parasite known as Plasmodium species and can be transmitted through a bite of a female Anopheles mosquitoes. There are various forms of malaria species. We have the Plasmodium falciparum, which is the most common one, Plasmodium ovale, Plasmodium nivelsi, Plasmodium valvax, and Plasmodium malaria. The one that is more prominent in our society today is Plasmodium falciparum. So as an individual or as a layman, how will you know you have malaria? Because most times when anybody just feels slight headache, they feel it's malaria, they rush and get any anti-malaria and they take. And that's one of our major problems in terms of malaria, which is anti-malaria resistance. A lot of people come up with anti-malaria resistance due to the abuse of anti-malaria drugs. So now how will you know? What are the symptoms for you to be able to know you actually have malaria? First, you feel headache, like constant headache. There's a sign like constant headache, can be from your forehead or your back head, but there is majorly headache. First, you see body weakness, you're weak, you're tired, sometimes fever. There'll be a sudden rise in your body temperature. Some people even feel nauseous, going up to throw up or even vomit. So most times when you feel some of this symptoms, the best advice anybody can give to you is actually go to the hospital or run a malaria parasite test. The malaria parasite test is actually a test that confirms the presence of that Plasmodium species and which of the species is present. When the test comes out positive with 1 plus, 2 plus, or 3 plus, depending on the severity, then you can be able to identify if you actually have malaria or not. So after the malaria parasite test have determined or have confirmed the presence of the parasite, the next step is the treatment of malaria. So malaria can be treated using various routes of administration depending on what the severity of the malaria and also your preferred route. Most people prefer injectable, that's giving it IV or IM, intramuscular or intravenous. Most people just prefer taking the normal oral tablet. I'm going to be showing you different medications that requires different routes of administration and everything you need to know about malaria. Now, when we talk about different treatments of anti-malaria, so there are different types of anti-malaria, there are different classification of anti-malaria. So anti-malaria can be classified into various forms. So this is an example of the class of anti-malaria. So this brand is known as Amatem Soldier and it belongs to the class of artemether lumefantrine. Now, most people, this brand is very popular because of its palatability. It is very easy to swallow. It doesn't have that aftertaste or that artemether lumefantrine reflux that other uncoated drugs have. So now most people prefer this brand because it's easy to swallow, and when you swallow it, you don't feel like throwing up because the active ingredients of this drug have been coated in a gel-like form, making it more palatable for you to swallow. I'm going to be showing you various other types of. So this is another class of anti-malaria. So now this class of anti-malaria is also an artemisinin-based therapy, but this drug, also a brand name, an example of a different class of anti-malaria, is known as P-Alaxin. Now, what does P-Alaxin contain? Because this is actually a well-known brand. So P-Alaxin usually contains the hydroartemisinin piperacin. Now, this drug is very effective in the sense that now when your body has been exposed to every time giving artemether lumefantrine, this is a new chemical. When a new chemical like this is introduced into your body, you notice that it is highly effective because before the parasite can even want to overcome this effect of this drug, is going to be like very high. So P-Alaxin comes in different forms, and we have other brands of this dihydroartemisinin piperacin, but this is the brand I'm talking about now. You can have P-Alaxin TX, the one of 3 tablets whereby you take once daily for 3 days, or you can have the one of 9 tablets whereby you take 3 tablets daily for 3 days also. So depending on the brand. So this is a picture of P-Alaxin. Now, this is another example of an artemisinin-based combination-like therapy, and this brand name is known as camosunate. Now, camosunate is different from the P-Alaxin and also different from artemether lumefantrine because this contains a totally different substance, chemical compound. So the chemical compound contained in the camosunate is artesunate and amiodarone. So artesunate usually comes in We have below 1 years. We have the one customized with a milligram of below 1 years of each child. We have 1 to 6 years. We have 7 to 13 years, and we have 14 and adult dose from above. So now this is a different type of combination therapy which contains artesunate and amlodipine. So I'm going to be talking about a different chemical compound entirely, which is known as sulfadoxypyrimethamine. So coming in a brand of Cedar, we have Maldox, we have Fancida, and various other wonderful brands. Now, what does this drug do? Most people will mistake it to a malaria treatment drug, but this drug doesn't treat malaria parasite. Instead, it prevents one from having malaria parasite. So this misconception of Cedar being or sulfadoxypyrimethamine active ingredient being the treatment for malaria, no, it only prevents but doesn't treat. And most people prefer it because it's just a daily dose. So their 3 tablets usually contain this and usually taken at once a day, and that's all. So it's more like a preventive measure, not a treatment measure. Thank Okay, so there are a lot more treatment regimen or a lot more drugs or different other classifications for treatment of malaria. But these are the few I can be able to point at now. So if you want to go to the side of injectables, so you can use our email. Email is the brand name for AB Atita. There are different brands of AB Atita you can use depending on your weight. They know what to give when you meet a qualified healthcare practitioner. Or you can also use your Artemeter 80 milligram per 2 meals injections. Or quite alright, you can even use your artesunate. So artesunate, depending, is usually given one day at 0 hour, 12 hour, and 24 hours, depending on your weight. They give you artesunate, which is also good. So the best regimen I believe in is actually doing a 2-step therapy whereby you start with an injectable and finish with a tablet. So those are the best way of treatment of malaria. So when you feel all these symptoms, anything about malaria, please feel free to visit the hospital, come to the pharmacist, run adequate tests. Self-medication is out of it. So self-medication is usually out of it. Like anytime you feel symptoms, best way, visit the hospital, come to the pharmacy, run adequate tests. Do not do self-medication, because most times you may think is this because you're used to your body, but it's not. That's not actually what you're going through. So most times when you even take medication, you notice it's not working for you. Sometimes it's not like the drug is not good or the drug have expired or something. Most of it can be because of the abuse of self-medication, like leading to anti-malaria resistance or even antibiotic resistance. Because one thing about our body knows how to adapt to situation. So in a situation whereby you are always taking anti-malaria, any small slight headache you're taking, your body gets used to that chemical compound. So when you actually take it, when you actually have malaria, you notice that the efficacy of that drug will be very low. It will have no effect because the body will just see it as a regular neighbor. I don't know if you understand what I'm saying, but your body will just see it as a regular neighbor. So self-medication is not good. Say no to self-medication. Beware of anti-malaria resistance. Treat yourself. Protect your health. Health is life. If you don't have health, there's no how you will. How will I put this in? If you don't have health, there's no how you will live. So treat yourself. Your health first. Very, very important. Bye to the next episode with pharmacist Diana.